here actually to talk about pets and CKD. And Kristin is an associate veteran in St. Louis, outside of St. Louis, Missouri, right? And Kristin has dogs and cats that she takes care of and exotic pets. And you also have quite a few of your own.
I have way too many of my own.
Absolutely. And you have your own story about CKD as well, right?
I do.
So you were diagnosed in 2019 with FSDS, right?
Yep.
I was
in
I tell you what, if
time.
you would like to share more about that, you're welcome to. And if you'd like to start your presentation, go ahead and go.
All right. So I am Dr. Kristin Brunstein, and I'm going to be talking with you guys today about pets and kidney disease. So basically, how can you keep your pet and still have a chronic illness? So my first slide is just, a little bit about me. So I've actually been in veterinary medicine for about 10 years now. I know I don't look like I'm old enough for that. I did actually start working at a clinic when I was in high school. I wanted to see, can I do this? Is this something that's feasible for me? And that kind of just set off, lit something in me that made me realize this is what I want to do. I am a 2021 graduate of the Auburn University College of Veterinary Medicine. So I did my undergraduate as well as vet school in Auburn, which is located in Alabama, about 2 hours west of Atlanta, Georgia. Currently, I'm an associate veterinarian at a small animal practice in the St. Louis metro area. I actually live in Illinois, but when I say Illinois, people are like, oh, you're from Chicago. I'm like, no, not even close. So I'm about 30 minutes from St. Louis. I see mostly small animals, so cats, dogs. I do see exotics as well. So I see birds, I see reptiles, and your pocket pets or your small animals or small mammals. So rabbits, guinea pigs, and things like that as well. So going back to my kidney disease that Cher had brought up, I was diagnosed when I was in my third year of veterinary school. It was a very incidental finding. I wasn't really prepared. I mean, no one really can for that. I had gone into my doctor for something completely unrelated, and he said, let's run some tests. Let's make sure you don't have anything. And it came back that my kidney values, my BUN and my creatinine were quite high. And I went through ultrasounds, I went through biopsies and things like that to finally get some answers. I actually just had my regular yearly exam with my doctor beginning of this month, so about 2 weeks ago. I am still holding stable. At my present moment, my GFR is at 35%. So I am not in need of a transplant or dialysis just yet. I'm slowly inching my way there. But over the past couple of years, I've declined in about 10%. So if I keep going at this rate, I'm okay with that. It gives me a little bit of time to get things in place. But yeah, so right now I am stable. I am doing well, trying to be a good egg when it comes to my diet and other things. So yeah, and then I have way too many animals in my home. I currently have 3 dogs, 3 cats. I have an aquatic frog. I have a 39-year-old bird. That's this white thing right here. I love her dearly with all of my heart, but she is a jerk sometimes. And then I have 2 horses that my mom and I take care of together. So I have a small zoo. It's a little crazy. So that's a little bit about me. So today I've been asked to speak on the topic of, pets and kidney disease. So my thought process for how I wanted to approach this was, how can I best help you guys stay safe, and even myself? So one thing that I do want to mention is, please be advised that as a veterinarian, I am not legally allowed to make recommendations for humans. So I can't answer questions about maybe, your specific concerns. I can't technically recommend any treatments to you. All I can really tell you is, if you are worried about something, definitely talk to your human physician. So my approach for my presentation today is going to be, what are some of the diseases that we're most worried about in veterinary medicine that can be translated to humans? And how do you best keep yourself safe and keep your pet safe? Because ultimately, that's how we keep you happy and healthy. So what that basically means is, I'm going to be talking about zoonotic diseases. So big thing is, what is a zoonotic disease? Zoonotic disease is any disease that can be transmitted between humans and animals. That can be a bacteria, it can be viruses, it can be fungi, or it can even be parasites. They are quite common. We do see quite a lot of those. And they can be spread multiple different ways. So it can be in the saliva, it can be from feces, it can even be aerosolized, depending on what it is. And that kind of goes back into that bullet thing that I have down there about One Health. That's one thing that they talk to us a lot about in vet school, is One Health is this thought process that there's these three different aspects to the overall health of the world. You've got human health, you've got animal health, and you've got environmental health. And those all have to work together to create an overall healthy environment. We can't have human health without animal health. We can't have animal health without human health. And we can't have those other two without keeping the environment clean and safe. So we're going to talk about a couple zoonotic diseases. This is a list that I came up with of a couple zoonotic diseases that stick out in my mind as being fairly common and fairly important from a small animal veterinarian perspective. If you were to have a large animal or an equine veterinarian come and talk to you, their list might be a little bit different than mine, just because they see things a little bit different than what I see. So your most common ones, rabies, that's the big one that a lot of us know about. We've got Salmonella, we've got Yersinia, we've got Leptospirosis, bunch of internal parasites or intestinal parasites, Psittacosis, Toxoplasma, there's vector-borne diseases, Brucellosis, and Bartonella. We're not going to necessarily talk about all of those, but we're going to hit on quite a few of them because I think they are pretty important. So we're going to go to rabies. So rabies specifically is an RNA virus. So RNA just specifies what is the genetic code inside the virus that allows it to do what it does. So any mammal is on this planet is susceptible. So cats, dogs, ferrets, skunks, cows, horses, really anything that's warm-blooded can become infected with rabies. It does mainly affect the nervous system, and it is primarily spread through saliva, whether that is a bite, whether that is some sort of wound that saliva then gets into. Bites are going to be your most common way that you see it spread. And then there are certain animals that are more prone to carrying rabies. So a lot of our cats, dogs, and things like that are vaccinated for this. It's actually, in most states, it is legally required that your pet is vaccinated for rabies because it is such a deadly, devastating disease. So, wildlife is a lot of times where we see this come into play. So that's the big thing why whenever you see an injured animal, they always tell you don't touch it, don't interact with it, leave it there, because you could potentially come into contact, whether or not they bite you. If you come into contact with their saliva and you somehow have a break in your skin barrier or a wound, it could potentially get in that way. So it has the highest fatality rate of any zoonotic disease out there. Rabies is one of those things that once you see the clinical signs of it being in the system, it's already too late. So that's why if you ever interact with wildlife or you ever are bitten, even by an animal that you think is vaccinated, it's always best to go get yourself treated right away. So there are rabies vaccines out there. Like I said, they are legally required in pretty much every state. And even if you're going overseas, a lot of times countries overseas will have different mandated time periods on certain vaccines you can use, how recently the vaccine needs to be given, and things like that. And that's given through an injection, a traditional vaccine route. There actually has been wildlife vaccines made that can be given orally or through the mouth. So, to deer and to skunks and raccoons and things like that, they'll make it really tasty, so to speak. I haven't personally tried it, so I can't attest to if it tastes good or not. But they'll go and spread it in the hopes that the animals will eat it and help have some immunity to it. Because, our cats and dogs are vaccinated in most cases, but wildlife, we can't really round all of them up and vaccinate them. It's too stressful. There's too many. It's just not feasible. So this is a way that we can do it to help kind of cut down on that. Rabies is something that in some ways is very specific to the species. So there is specifically dog or canine rabies. There is specifically skunk rabies, but that doesn't mean that it just stays in that species. It can go between others. It's just where that virus kind of originated and predominantly lives is that species, but it really can go to any of them. So rabies is the biggest one. That's the one that I worry about on a daily basis. It's at the forefront of my mind in a lot of things that I do. If you are a person who is working in a field where you are exposed to a lot of animals or animals that you don't know the status of, so doing shelter work, veterinary medicine, like what I do, there is actually a human rabies vaccine. It is a 3 series. It is very expensive. And sometimes you do have to get boosted for it. So for me personally, I was required to get it when I was going through clinics in veterinary school. So I am somebody who is vaccinated for rabies. And even if it wasn't required, I still would have done it because being an immunocompromised person, the last thing that I need to do is worry about that. But if you don't have significant exposure, you don't necessarily need to, but there is post-exposure vaccines as well. So if you have any sort of animal bite, you need to get treated right away. And that's something that you and your human physician can talk about if you feel it's necessary. So then on to the next one is Salmonella. That's one that a lot of us have heard about with our undercooked meats. You know, this is why we always say cook your food to a certain internal temperature to make sure that we've taken care of all of this. So Salmonella is a bacteria. It's commonly spread through feces, but it can also come from undercooked or uncooked meats. So anything that's raw. Another place that we can see it regularly is in our reptiles and amphibian patients. And I have a couple of the ones that I've seen here. This is Spyro. He's a bearded dragon. And then this is Nugget. He is a crested gecko that I actually did a tail amputation on. So there are certain species or certain types of reptiles that Salmonella is actually a normal bug that's in their GI tract, that it actually is helpful to them. So it's not harmful, but it still can be harmful to us. So these are the animals that a lot of times I hear people being told, hey, if you're immunocompromised, you shouldn't have them, which if you're not comfortable with it, absolutely, you need to listen to your physician. But there are ways to be safe and still have these animals and do those things. The big thing that we worry about is, cleaning the feces, making sure we stay on top of it. And that, we don't let anything get too dirty. And then definitely, don't kiss these guys, don't put them near your mouth, make sure you wash your hands after handling, just generally being clean if you're interacting with these guys. Like I said, I see reptiles all the time. I don't see amphibians. I do see reptiles regularly. So, and I am an immunocompromised person with kidney disease. So I have to be careful with these guys. I always make sure that I wash my hands. I have my technicians who are wonderful, wonderful people. They help me sanitize my stethoscope, anything that I've used during that appointment. We have a protocol for it. They decontaminate everything so that I'm not potentially picking something back up. The other big thing is raw diets, especially for your cats and dogs. This is something that has kind of gained a lot of traction in the past couple of years, is pet owners wanting to feed their cats and dogs raw diets. And it's something that, as an immunocompromised person, you're exposing yourself and, potentially others in your home, as well as your pets, to different diseases. And Salmonella is one of them that we do worry about. So making sure that you are not feeding your pet a raw diet. There is no nutritional benefit to doing it. And if you're not a fan of already cooked kibbles and things like that, you can do a homemade diet as long as it's cooked. There are resources for how to balance and do that appropriately, but a raw diet, there is no benefit. There's actually more risks to it than the other alternatives. So definitely recommend avoiding that. And then the next one is Yersinia. So Yersinia pestis, a lot of people, I don't think, know what that is. That is the bacteria that actually caused the bubonic plague. Yes, that exact plague. It is still alive and well. It's actually in the United States. Most people don't know that. They're like, oh, that was the Middle Ages. That's not anything we worry about. It is very much a thing. We commonly see it in the western or southwestern portions of the United States. So areas where we tend to have prairie dogs is the big thing. So it's a bacteria. It's carried by fleas, and then the fleas come and bite, and then it's in their saliva that is infected that way. So oftentimes when we see Yersinia anymore this day and age, it's actually in cats. So, people, and when they live out west or southwest, if they let their cats go outside and roam around, they can actually pick it up from doing natural cat behaviors like hunting mice and things like that. If any of us remember our history and remember anything about the plague, everybody thought, oh, it's the rats, oh, it's the smell. It's actually the fleas on the rats that then can transmit it. So cats going out and hunting mice and hunting rats, they actually inadvertently pick it up. They have it, and then the fleas on them get it and can give it to you if the infestation is bad enough. So the plague is not as devastating as it was back then. We have modern medicine, thank goodness, but still something that we have to be careful about. It can be pretty intense. There actually are roughly 10 cases per year of the plague in humans still, and it's usually in the western part of the United States. So if this is something that you are concerned about, definitely talk with your veterinarian about it. As long as your pet is on some sort of flea prevention and you're not letting your pet go outside and hunt, you should be safe. But there's always a chance, but just something to have in mind. Definitely don't interact with wild animals. So don't try to be Cinderella or Snow White and go out and make friends with the squirrels and the mice and everything, or prairie dogs. You're safer just not doing that. And then next big one, leptospirosis. This is one of the ones that I find very important. Leptospirosis is something that's very big in the area that I live in. Living in the Midwest, we have so many deer, and deer are a very big reservoir for harboring this bacterial infection. So it is a bacteria. One thing in school that we learned about it is they call it the great pretender. Leptospirosis infections can really look like anything. They can be very mild and seem like, a little bit of a stomach upset and we get through it, all the way into we can have multi-organ failure and sometimes even death if it's severe enough. So it's a little bit scary in that sense because it doesn't have a very characteristic look in how it presents. It could really be anything. So commonly we do see it in wildlife. So squirrels, deer, raccoons, anything like that, they can be infected with it. And the way that you pick it up is actually coming in direct or even indirect contact with either urine or actually milk from these species. So this is something very important that we can see it in cattle. So this is part of the reason that you should not drink unpasteurized milk. You can potentially pick it up that way. Really shouldn't drink unpasteurized milk from any creature simply because there are other zoonoses. There is listeria, there's brucellosis and things like that. So just don't drink or ingest raw milk. Don't interact with it. You're safe or not. And then the urine. Urine is the big way that we see it come into contact. So lepto is something that you're more than likely to get it from your pet than you are to get it from one of the wild animals, simply because we as humans, we kind of have a standard of cleanliness we like to adhere to. I know me personally, I'm not going to go drink out of a standing water puddle, but my dog will. So oftentimes the dog is going to be the one that picks it up, gets infected, and then what do? I love my dogs. Sometimes they lick you, and then you get it that way. So this is something that really is very important because you do oftentimes get it from your pet. So they'll come into contact with the urine from contaminated areas. So, if there's a common area of water, so lakes, ponds, puddles, things like that, where animals like to come and drink, oftentimes they urinate. They do a lot of their stuff right there together. And then your dog goes and drinks out of that water, and then they've just picked it up. So lepto is something where there actually is a vaccine for it. In my area, I recommend pretty much anybody have it. Say if you don't have a 6 to 8 foot fence in your backyard and your dog leaves your house at all, they need to be vaccinated for leptospirosis because their chance of coming into contact with it, especially in the Midwest where we have so many deer, is very high. So definitely talk to your veterinarian in your area, see where your risk is for your animal picking up leptospirosis, but it's one of those things that it's better to be safe than sorry. It's not worth it to take a chance on this, especially since it is urine-based. It does like the kidneys. We're all here because we have kidney issues, and that's something that we definitely need to keep tabs on. And then intestinal parasites. I hope you guys enjoy the GIF. I figured out how to put it in here just for this. So intestinal parasites are something that I deal with a lot. Not many people do, but that's okay. So there are a couple different ones that we worry about that are fairly easy to pick up. So your roundworms, your hookworms, your tapeworms, and Giardia is another one. Giardia is a bit of a complicated one because we are not 100% confident that it can go between species. Some of them can, but it's hard to know who. So still just better to be safe than sorry on that one. Most of these are transmitted through a fecal oral route. So somehow the fecal particles have to get into your mouth. I know that sounds very gross. And then tapeworms actually come from fleas. So fleas have tapeworms internally. When your animal accidentally ingests a flea while they're itching and grooming themselves, then they can get infected that way. So keeping your animal on some sort of prevention to help prevent fleas, helping prevent these roundworms and hookworms, does in turn keep you safe because then you don't have to worry about getting these. Some of these parasites, some of them just steal your nutrition. So tapeworms don't actually attach, they just steal the nutrition from the GI tract. Roundworms and hookworms actually can cause damage to the small intestines, can actually result in blood loss in some cases. So keeping your pet on prevention, keeping them from getting these, then in turn keeps you from getting them. We don't have to worry. Next one is Psittacosis. So it is a bacteria. It is in fact a chlamydia bacteria. No, it is not the same kind of chlamydia as we think of the venereal chlamydia in humans. It is different. This is a bird-specific chlamydia that can go to humans. It does usually cause respiratory-related signs. It oftentimes is in our pet birds. It is not terribly common. So if you have a bird, please do not panic and think, oh my gosh, I have to get rid of it. I myself have a bird. The big thing with it is if your bird comes down with any sort of respiratory, any sort of, funkiness there, definitely have your bird evaluated. It is something that we can culture or do a PCR for to make sure that your bird is not infected. Oftentimes it's a very chronic infection in birds, so it can be hard to get rid of. So there are two ways that you can get it. You can get it from the feces, but it can also be obtained through inhalation. So this is why you have to be very safe if you do interact with birds in any capacity, that the way that you're cleaning their enclosure can be very important because it could potentially expose you to this. So a lot of people say, oh, you should power wash your bird's cage every so often. That can be a great thing because it can keep it very clean. But in turn, when you're doing that, sometimes you are aerosolizing particles from the feces that's very stuck on there. So usually I tell people, do as good of a clean as you can. If you find that you do need to power wash or do something of that nature, wear a mask, wear gloves when you're doing that to help avoid that inhalation. This type of chlamydia is actually reportable. So making sure that you tell your local or state government that, hey, we do have a case of this. Best way to avoid it is making sure that you get your animals from a reputable breeder. So don't just buy your bird from, a random person off of the street, making sure that they come from somebody who takes the proper protocols of quarantining any new birds and things like that when they come in. Other big thing that we worry about with this is backyard poultry. So chickens, ducks, and turkeys are something that we worry about with this, especially because they are usually outside and they do come into contact with feces from the wild bird population out there. So if you have any backyard poultry, anything like that, definitely recommend trying to keep everything for them as clean as possible, trying to make sure they have some sort of inside enclosure that keeps them somewhat covered, and not that way they can still have some access to outside, but keeping them fenced in so they don't have direct contact and just being as clean as possible. Or honestly, just not having backyard poultry if you're worried, if you're in an area where you can see this a lot. The next one is Toxoplasma. So I'm sure this is one that a fair number of us have heard about. This is the one that you really worry about with pregnant individuals. A lot of times, this is the reason that your doctor will tell you if you're pregnant, you do not need to be cleaning the cat litter box. Somebody else needs to do it. So this is a protozoal parasite. So it's not a bacteria, it's not a virus. It is actually a little tiny parasite itself. You do come into contact with it from feces, but it can also be obtained from uncooked or undercooked meats. And that's oftentimes how cats pick it up. You can get it from the soil. Usually the soil is because there's cats roaming around outside. Cats like to use a litter box. Soil is a great alternative to litter when you're outside. So making sure that when you're gardening, you're wearing gloves, making sure you're washing your hands thoroughly, scrubbing under those fingernails after you've been outside interacting in your garden. So cats are the big thing that we worry about with that. So, if you have a cat already, please do not think that you have to go out and get rid of your cat. Just make sure that you are taking the proper precautions. Don't scoop the litter box with your bare hands. Use a litter scoop. Make sure you keep everything clean. Wash your hands with warm soapy water for an appropriate amount of time afterwards. So oftentimes with this, our cats are clinical or subclinical or asymptomatic. Most cats have it and don't have a problem. It doesn't tend to cause an issue. And to be honest with you, most humans that have had cats at some point in their life do already have it. They are already infected with it. It's just gone into a dormant phase in their body. So just, being as clean as you possibly can is the best way to avoid this. Don't think you have to get rid of your cat. And especially if you are a pregnant individual, very important if you have somebody else scoop the litter box during that time frame, just to be extra safe so you don't become infected with it during the pregnancy. And then vector-borne. So a vector is any sort of a creature in the life cycle that requires the disease, where the disease requires to go through them to then go on to the next phase. So Lyme disease is one. We see that it comes from ticks. West Nile virus comes from mosquitoes. Then we've got Rocky Mountain spotted fever, which is also from ticks. And then tapeworms and Yersinia, which are two that I had previously talked about. So, with us, we're able to check. We're not near as hairy as the patients that I see. So, we're able to check ourselves, making sure that if you go out and do any sort of hiking or anything, checking yourself right away. The big thing to avoid any sort of vector-borne transmission is removal of the vector as quickly as possible so that they aren't attached for a set amount of time to then spread these things to you. Lyme disease is something that there is actually a vaccine for it. So if you are in an area where Lyme disease is very prevalent, definitely talk to your veterinarian about having your pet vaccinated. If you like to go hiking like I do with my dogs, definitely worth it to get them vaccinated for that so that we're not perpetuating that life cycle. It's not something that if your pet gets it, they can give it directly to you. It's just something that if your pet gets it and then gets bitten by another tick, we're continuing on the life cycle and just, potentially making it where you could get it down the road. West Nile virus, that's something that, we've all heard about. It was in the news pretty big many years back. So it actually comes from mosquitoes. So, trying to make sure that you have mosquito repellents and things like that when you're outside. Horses are actually a big one that we worry about in the United States with this. There is actually a vaccine in horses for it. Horses you can't really keep inside. If you can, please tell me how. I would love to know how I can keep my boys inside. But vaccinating them for it because they do live 90% of their life outside or constantly exposed to the elements, making sure because they are large animals, mosquitoes have a lot of area to bite, they can very easily spread that. Rocky Mountain spotted fever, again, that is a rickettsial disease that we can see from ticks. One of my horses actually did personally have it at one point in time. So again, anytime you do anything in an area where ticks are very prevalent, make sure you're checking yourself, make sure you're checking your pets. If you have a cat or a dog, keeping them on a prevention can actually help prevent ticks from biting and attaching. Not all preventions will, certain won't. So make sure that you talk to your veterinarian about what product is best for your pet based on their exposure to different diseases and things like that. So now the big question of how do I keep myself safe from all of these big scaries that you just talked about being an immunocompromised person? So the big thing is make sure that you wash your hands after interacting with animals, whether it's a cat, dog, a lizard, anything like that. Wash your hands immediately afterwards so that you're not touching your face. That way you're not touching other things that you may then touch later and then potentially infect yourself with. Wearing gloves when necessary. That's something that I, as an immunocompromised person, do in my job quite a bit. I have talked with all of my technicians. They are all very aware. I'm very honest with them about that. They are very good about letting me know, hey, this animal's on a raw diet. Hey, this animal has this disease in the past. Hey, we're worried about this. So making sure that I can wear the appropriate personal protective equipment or PPE. That way I'm putting an extra barrier between myself and that potential disease. Or if completely necessary, having a different doctor see that patient if I have to. Wearing a mask when needed. I did have a patient the other day who I was very worried about something with, so I decided I'm going to wear a mask and gloves. That's never the wrong thing to do. If you're worried and it's going to make you feel better and going to keep you protected, absolutely do it. Doesn't mean that you have to wear it all the time, but just to have, again, an extra barrier between yourself and a potentially infectious zoonotic disease. Vaccinating your pet. That is one of the biggest things. You vaccinate your pet for zoonotic diseases. We're in contact with our pets almost all the time. For many of us, they sleep in our beds with us. So by vaccinating them, you're keeping yourself safe because you're not letting something potentially come into your home. Keeping your pets on your preventative medications. So that's your heartworm, your flea, your tick, your intestinal parasite medications to keep that stuff out of your house, to keep that stuff off of your pets, because sometimes those bugs don't always stay on the pets. Again, they're in the bed with you. They can crawl onto you. As gross as that is, I've had it happen. I went hiking with my dogs and a tick, I saw it crawl right off my dog onto my bed. And I said, nope, we're not doing that. And then no raw diets. Please, 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 no raw diets. They have no nutritional benefit. You're increasing your risk. You're increasing your animal's risk. It's just not worth it. And then, even if it comes, and then when it comes down to avoiding a situation if absolutely necessary. I've had patients come in here where we're worried that they have lepto because their tests are coming back negative for everything else. In those situations, I have another doctor take over. We have multiple signs that go up and say, hey, KB, that's what everybody calls me because those are my initials. We have 2 Kristins here. They put a sign up that says, KB, you can't touch this. You can't do this. So having the people around you, if you're in a lot of exposure, having them aware of your limitations so that they can better keep you safe. And that's been an amazing thing for me as well. So just being a clean person, adhering to basic biosecurity, wash your hands, wash your clothes. Don't let your dog kiss you on the mouth. I love my dog dearly, but I'm going to kiss her right on the forehead between her eyes instead of on her face. Don't let your dog lick your mouth. Don't kiss your gecko. I know they're cute. I know you want to squish them, but please don't get salmonella. So now any questions? Those are my 2 gremlins. So yeah.
What a wonderful presentation, Kristin. I mean, really, I learned so much. I mean, I've seen the packages in at PetSmart for the raw diets, and I assume with animals, they have fad diets just like humans have fad diets, right?
Absolutely. And, the 2 fad diets that I'm seeing a lot of right now, raw diets are the big one. Those make me nervous. Anytime that I hear anything raw, I sit down and I have a very serious conversation with them. And then the grain-free diets. That's not anything related to kidney disease, but grain-free diets, they're not good. They're a fad. If you guys have questions about that, I can always answer that later. But raw diets are the big thing that I get worried about, especially with immunocompromised people.
Well, thank you for confirming on the grain diet because my vet said the same thing.
Yep.
As a matter of fact, I want to know how you were able to get a picture of my yellow lab scooting across the floor. Because she has gotten Giardia before.
Yeah, I was typing to Google. I was like, okay, this is what I have in mind. This is what I need. I said, dog scooting butt. And I found that GIF and I was like, this is perfect. This is everything that I need.
It was perfect. It was perfect. It actually looks like my dog. And with the reptiles and the amphibians, whenever you see them in the clinic, do you wear gloves?
So it depends. So for me personally, oftentimes I do not. And the reason that I don't is because when I wear gloves, I feel like it very much impedes my diagnostic ability. A lot of your exam with these guys is what you can feel, how things feel. Do they have retained shed? How does their belly feel? Things like that. And by wearing those gloves, I don't have the ability to feel things as well. So I am taking a risk with that, but I try to we have everything set out. I do everything in one fell swoop, and then I immediately wash my hands afterwards. My technicians then decontaminate the entire room. They decontaminate my stethoscope. We have a Doppler for me to listen. We decontaminate everything. That way I'm not potentially picking it back up, just because that's a spot where I'm not able to mitigate my risk with gloves. So I do the next best alternative.
Okay, super. Wonderful. Well, we have a couple questions. Okay, this is a good question. How about no raw carrots for my dog, right? I mean, are you talking just about meats, raw meats, or
So
raw
I'm talking,
vegetables?
yeah, so I'm talking specifically about raw meats. Raw meats are where we really worry about getting salmonella from. Not that you can't potentially get different things from produce. Ideally, no uncleaned produce for your pets. So when you buy carrots, if you buy other things like that, making sure that you're washing them before you feed them to your pet. There are definitely things, the most common fertilizer is related to cow feces because it's so rich, or even horse feces. So making sure that you wash any of your fruits and vegetables before you feed them to your pet. Those are completely safe. The big thing that I don't want you to do is the raw meat portion of the diet. That's the part that has me most concerned. So raw carrots, yes, as long as they're washed. Raw meat, absolutely no.
Super. Thank you very much, Kristin. And I'd like it to let everybody know that we do have on our website, we do have a podcast on animal care and kidney disease by Dr. Villicana. It is a podcast, and I encourage you to listen to it. It's a very good, informative presentation, just like Kristin's. And let's see, I think I am ready to go ahead and thank you, Kristin, for coming today. And Isela, would you like to introduce the next presenter? Are
Absolutely.
you up next?
Yeah, I'm up next. Yeah, Kristin,
Okay.
I also just want to thank you for that. I know a lot of us have furry friends, so that was very helpful. Thank you so much for coming.
Thank you guys for having me. I appreciate it.
Absolutely.
And a shout out to our corporate mission partners for making this happen.